Nervous System Diseases Lecture. In this lecture, we will identify the etiology, symptoms, diagnosis, and treatment of nervous system disorders. The first nervous system disorder we will talk about is encephalitis, which is the inflammation of brain tissue, or the white and gray matter of the brain. The etiology is caused by a variety of different microorganisms, but the most common are mosquito, tick, and other insect bites. The symptoms of encephalitis are headache, febrile, stiff neck and back, lethargy, mental confusion, and even coma. The diagnosis is finding the causative agent in the spinal tap fluid, and the treatment is anti-infective medications depending on the causative agent, whether it's a bacterial, viral, fungal, or parasitic infection. And then the palliative treatment is sometimes the case in encephalitis depending on what the causative agent is. Sometimes there are not anti-infective medications that can treat. Meningitis is the inflammation of the meninges, or the covering of the brain and the spinal cord. So a little bit different. It does not infect the white or gray matter, just the covering. The etiology is anything causing an inflammatory response, so bacteria, virus, fungi. Sometimes we see this in patients with lead poisoning or arsenic poisoning. And the symptoms of meningitis are high fever, severe headaches, photophobia, stiffness in the neck, seizures, and stupor. The diagnosis is finding the causative agent in the spinal tap fluid. And the treatment for meningitis is antibiotics if it's bacterial, antipyretics, anticonvulsant medications, and a quiet, dark environment. And as you can see in the picture here, on top we have the normal meninges, we have the skull here, and then the dura mater, the arachnoid, and the pia mater. And down here on the bottom, you can see that the dura mater, arachnoid, and pia mater are very inflamed. And this is what causes meningitis, and it causes pressure on the brain. Poliomyelitis, oftentimes we refer to this as polio, is a viral infection affecting the brain and spinal cord. The etiology is the etiology is viruses that spread to the oropharyngeal, that are spread by oropharyngeal secretions and by infected feces. Symptoms are muscle weakness, muscle stiffness, nausea, vomiting, muscle atrophy, and paralysis. And you can see the muscle atrophy in the picture here. Diagnosis, examination, and culture of the throat, feces, and spinal fluid. And then treatment is analgesics and bed rest. Physical therapy and limb braces are also used. Once you contract this disease, there is no cure for it. It's just controlling and monitoring symptoms. So it is very important for prevention of poliomyelitis is to get the polio vaccine. In third world countries, they have the oral polio vaccine, or if several years ago in the United States, that's what we used, and now we use the injectable form of the polio vaccine. Rabies is fatal encephalomyelitis, which the etiology is caused by a virus and primarily affects animals, but can be transmitted to humans by a bite. So it is very important once bit by an animal to receive the proper treatment, especially if we do not know if the animal has been vaccinated against rabies. Symptoms include fever, pain, paralysis, convulsions, and rage, inability to swallow, and drooling of a frothy saliva. Diagnosis is observation. Lab tests are not helpful in the diagnosis of rabies. Treatment, once a person is bit, you should wash the area with soap and water thoroughly. A series of anti-rabies injections should be given. And once a person contracts rabies, there is real no cure. Generally, contraction happens several weeks after the bite. So if you receive the anti-rabies injections, that prevents the contraction of rabies. Shingles is an acute viral disease fairly common in the elderly. Some of you may ask why shingles is under the neurology group of diseases, and actually shingles is the varicella virus that lays dormant in the nerve endings of a person. And when the nerve endings are irritated by stress or another virus or illness, the shingles will become present. And some of the etiologies, the etiology is caused by the herpes zoster in older populations with limited immunity. Chickenpox virus lays dormant in the nervous system and exacerbates in times of stress and immunosuppression. So symptoms are itchy and painful red rash, as you can see in the picture here, with small vesicles that follow the nerve that is affected, usually appears on the trunk of the body or the face, and is usually limited to one side of the body. Diagnosis is observation. Treatment is really palliative. There's no way to fix this or get rid of it. Once you have it, acyclovir and valcyclovir can be given within 24 to 72 hours of the start to try and deter the actual start of shingles, and analgesics can be given. In order to prevent shingles, we can give the Zostavax vaccine, which is approved for use in people that are 50 years or older. Cerebrovascular incident, or CVA, also called a stroke. The etiology is due to poor blood supply to the brain. There are three common causes. There is a cerebral thrombus, which you can see here. The area is deprived of blood due to a blood clot that blocks the flow of blood to the brain. A cerebral embolism, which also deprives the area of blood, and this is a fatty plaque or blood clot that breaks away from and flows to the brain where it blocks an artery. So a lot of times this will break away in the heart or the lungs or another place in the body and travel to the brain. Cerebral hemorrhage is an area of bleeding and breaks in the blood vessels. It's also called an aneurysm in the brain. This is another reason for stroke. Symptoms include dysphagia, hemiparalysis, confusion, poor coordination, hypertension, headache, and vision changes. We diagnose this by examination, EEGs, and CT scans. Some of the treatment is anticoagulation and hypertensive medications, physical and speech therapy. And if you act fast, so if you witness patients with face, arm, speech impairment, and you call 911 and get that person into treatment right away, a lot of the symptoms and some of the residual symptoms can be prevented by giving the patient a medication called TPA. Transient ischemic attack, or TIA, is also called mini strokes. The etiology is insufficient blood supply to the brain due to an artery narrowing. The most common artery that is the culprit is the carotid artery in your neck. Symptoms include weakness in limbs, dizziness, slurred speech, mild loss of consciousness. Diagnosis is examination, CT scan, carotid ultrasound, and sometimes we'll do an arteriogram on the carotid artery. Treatment, if it is carotid in nature, we will do a carotid endarterectomy. Bell's palsy. Sometimes people get this confused between a stroke. Bell's palsy affects the facial cranial nerve, the seventh cranial nerve, I should say. The etiology, it can be idiopathic, but possibly due to a viral disease, autoimmune problem, or ischemia. Symptoms include lateral paralysis of the face, inability to close affected eye, and drooling of saliva. A lot of times these symptoms are short-term and usually patients do recover over time. So major symptoms are drooping of the eye here, loss of nasolabial fold, and the drooping corner of the mouth. Diagnosis is an EMG and MRI scan, and treatment is analgesics and anti-inflammatory medications, and it usually resolves on its own. Cephalalgia or headaches is typically a symptom of other disorders. The cause can be from tension on the facial, neck, or scalp muscles. Vascular changes in arterial size inside the head can cause headaches. The etiology, some are environmental and some are emotional factors. Symptoms include pain described as pressure, throbbing, or stabbing. There are a couple types of different headaches. There's tension headaches, cluster headaches, post-lumbar puncture headaches, and migraine headaches. To diagnose these, it depends on the history and the physical, and it can include a chest x-ray, EEG, or CT scans to determine the cause of the headaches, if any. Treatment, lifestyle changes, acetaminophen or ibuprofen, and for cases of migraines, we will do Maxalt or Imitrex. Epilepsy is a chronic disease with intermittent episodes of abnormal electrical activity in the brain. The etiology can be brain tumors with neurological disease or scar tissue due to trauma or stroke. Some cases are unknown. Some cases are from infection, drug abuse, or tumors. Symptoms of epilepsy are convulsions or seizures. There are 3 different types of seizures. There's petit mal, grand mal, and status epilepticus. The diagnosis for epilepsy is usually EEG, CT scans, and cerebral angiograms. And the treatment is anticonvulsant medications. Parkinson's disease is a slow progressive brain degeneration. The etiology is unknown, but deficiencies in dopamine have been found in patients. And as you can see down here, we have a synapse here, and you can see the neurotransmitters of dopamine in plentiful amounts, which are being uptaked by the receptor cells here in a healthy patient. In a patient with Parkinson's, there's hardly any dopamine, and you can see that the receptor cells have a lot less dopamine in order to function. Hence why patients with Parkinson's disease have rigidity and immobility in their hands, slow speech, fine tremor, and pill rolling motion of the fingers. They can be expressionless and have very little facial appearances, have abnormal bent forward posture and abnormal gait due to the muscles not getting the proper response from the synapse. Diagnosis is history and physical examination, and treatment are dopamine replacement drugs. The most common is carbidopa-levodopa. Multiple sclerosis is where the myelin is lost and there's destruction to the myelin with varying degrees of oligodendrocytes that are injured and die. White plaques replace the myelin. The etiology is unknown but is thought to be an autoimmune disorder or viral infection that causes this. Symptoms include nerve pain, weakness, loss of coordination, visual impairment, and speech disturbances. Diagnosis is history and physical, MRI scan, and a spinal tap. Treatment, there is no cure. Several drugs to suppress immune system, for example, Tecfidera and Avonex are very common drugs for multiple sclerosis. And as you can see here in the picture, on the left-hand side we have a normal myelin sheath, and then on the right-hand side we have the scarred myelin sheath where there is much deterioration that is being replaced by the white plaques. Amyotrophic lateral sclerosis, or ALS, sometimes this is also called Lou Gehrig's disease, is a progressive degeneration of the motor neurons. The etiology is really unknown at this point. However, there is significant research being done. Symptoms include loss of muscle tone, affects breathing and mobility in the progressive stages. Diagnosis is history and physical, MRI scan, EMG, nerve conduction, velocity tests can also be done. There is no cure. Riluzole slightly slows the progression, but really there are no treatments. In the picture here, you can see that the dendrites are a lot smaller, and so are the axons. Therefore, there's not as much messaging that is relayed to the muscles, and muscles become atrophied and damaged. Dementia, there's a loss of mental ability due to the loss of neurons in the brain cells caused in several ways. There's 4 major types of dementias. There's Alzheimer's disease, vascular dementia, head trauma dementia, and substance-induced dementia. Alzheimer's disease is a form of dementia characterized by the death of neurons and the replacement of these neurons with plaques. The etiology is unknown, but may be hereditary or history of head traumas are being closer and closer linked to Alzheimer's disease. Symptoms include loss of short-term memory, inability to concentrate, and slight changes in personality. Difficulty communicating, agitation, restlessness, disoriented, incontinent, and combative. The diagnosis for Alzheimer's disease can't positively be made except for an autopsy after the person has deceased, and may be made based on CT and MRI scans and what the family is reporting. Treatment, there is no known cure for Alzheimer's disease. However, there are medications to slow the progression, such as Namenda and donepezil. And as you can see in the picture here, a healthy brain and then the deterioration that occurs throughout time. This is a slow progressive disease and does not happen overnight. Vascular dementia is caused by atrophy and death of brain cells due to a decrease in blood flow. Oftentimes the etiology is atherosclerosis, and symptoms are changes in memory, personality, and judgment, irritability, depression, and sleeplessness. Diagnosis is usually done by an arteriogram, and treatment is vasodilators and carotid endarterectomy if this is the problem for the vascular dementia. Head trauma dementia. The etiology is death of brain cells due to head trauma. Blows can cause edema and increase into intracranial pressure, causing brain cell death. Repeated blows to the head are oftentimes called boxer's dementia. Symptoms include decreased mental intellect and cognitive function, loss of the ability to reason and remember or show appropriate emotions, and aggression. Diagnosis is history, cranial X-ray, and MRI or CT scans, and treatment is prevention and rehabilitation and treatment. Head trauma dementia is being really called to attention in sports such as football, boxing, hockey, and those high contact sports. Substance-induced dementia is a result of severe depression, etiology, brain cell death from toxic drugs or toxins. Symptoms is mental impairment and decreased cognitive ability. Diagnosis is history and physical, family report, and mental exams. And treatment is really rehabilitation and psychocounseling. Insomnia is the perception or feeling of inadequate or poor sleep and the inability to fall asleep or stay asleep. The etiology is stress, pain, fear, depression, thyroid, or cardiovascular disorders. Sometimes drugs such as caffeine or bronchodilators can keep people up all night. And symptoms of fatigue and irritability. Diagnosis is made based on a sleep history, sleep study if there are breathing problems, and the treatment is removing the cause and lifestyle changes. Narcolepsy is a neurological disorder that affects the control of sleep and wakefulness. Etiology is really unknown. Symptoms are excessive daytime sleepiness, fatigue, and irritability. Diagnosis is a polysonogram and history and physical. Polysonogram is also called a sleep study. In short, that's what a lot of people use in the medical field. Treatment is medications such as modafinil or antidepressants. Sleep apnea is a sleep disorder characterized by periods of apnea or breathlessness at night while sleeping. Etiology is obesity, which is the main one, hypertension, airway obstructions, smoking, and alcohol. Symptoms are more than 5 periods of apnea lasting at least 10 seconds for each hour of sleep. Sudden gasps of air after the apnea occur, and daytime sleepiness, extreme snoring, and depression. Diagnosis of sleep apnea is a polysonogram or a sleep study. And here we have pictured the normal breathing airway, and as you can see, our airway is not very large, but when people are obese or have hypertension and there's dilation, this can become closed off for brief periods of time. And oftentimes this is the reason why we also snore, as we're trying to open up those airways. Brain tumors there can be primary or secondary tumors. The etiology is unknown. Symptoms are headache, vomiting, seizures, mood and personality changes, visual disturbances, and loss of memory. Diagnosis is history, symptoms, X-ray, CT, and MRI scans and biopsies. And the treatment is surgery, radiation, and chemo. Concussions and contusions. So concussions and contusions are two different things. Concussion is a heavy blow and a brief loss of consciousness. It causes disturbances of the normal brain's electrical activity. Contusions are bruising of the brain tissue. The etiology for both is a blow to the head. Unconscious, amnesia, and loss of memory, headaches, blurred vision, and irritability are all symptoms of both. Contusions will have a hematoma and an increased intracranial pressure. And the diagnosis is history, cranial X-ray, and CT and MRI scans. Treatment is bed rest and sometimes shunts for intracranial pressure. It's really important. A lot of times we get our concussions from maybe a car accident or a sports injury. And what happens is the brain shifts in the skull here from back and forth and causing bruising or torn tissues and sometimes swelling. It's really important for athletes not to go back into the game and risk that possibility of getting a second blow to the head, because when a player who is not fully recovered from a concussion suffers a second blow to the head, it can be fatal, and that's because the brain swells and blocks off blood flow and can be deadly. Quadriplegia and paraplegia. Quadriplegia is paralysis of both arms and legs and is usually due to a cervical spine injury. Paraplegia is paralysis of both legs and usually is due to a lumbar or lower thoracic injury. The etiology is spinal cord injury from an accident. Symptoms are varying degree of movement loss, loss of bowel and bladder control, hypothermia, bradycardia, and respiratory problems, depending on if you're paraplegia or quadriplegia. Diagnosis is history and physicals, X-ray, CT, or MRI scan, and a myelogram. Treatment is surgery and rehabilitation. However, a lot of times once you injure your spinal cord and become quadriplegia or paraplegia, there is no real treatment to recover from that. It's just monitoring symptoms and getting you to a place where you can live adequately from there on out.